very much. It's a great honor and a pleasure to be here, and of course, listening to the eminent thinkers of not only India, of the world, because I feel that these thinkings के बारे में हम आज बात कर रहे हैं, मेरे ख्याल से ये सम्मान जो हम लोगों को मिल रहा है, वो सम्मान तो हमारे लिए बहुत एक खुशी की चीज़ है, हमारा रिकॉग्निशन है, बट एट द सेम टाइम मुझे इस बात का बहुत खुशी है और आई एम वेरी हैप्पी that I am sitting on the dais and with the persons of eminence who have created changes in the history of India and also had their influence over the world population and thinking of the world. And it's very inspiring for me, as much as it is for you, to be listening to these speakers. The odd thing about my presentation here is that I will be speaking with the help of some slides. Unfortunately, being the laparoscopic surgeon, I'm used to doing everything by looking at the television screen, because I'm not looking at the patient, but I'm looking at the screen. And that is the handicap which has come today, that instead of talking to you directly like all our speakers, I have to take help of the screen to make my presentation here. And at the same time, I feel that the message which I have to take is that I have to take my eyes off the screen. Unfortunately, I think, my family members and my wife also complains that you don't look at me when the television is on. So the story is because when the television is on, your surgical thing comes into picture. Because when you are operating, you have the television in which 4 instruments are there. Some has got laser, some has got knife, some has got a scissor. And you are controlling all the 4 ends inside the abdomen. And you cannot take your eyes off from the screen because you don't know which instrument can damage which organ of the body, and patient may find it fatal, even may lose the patient on the table. So that is the reason why possibly I am making a presentation, but at the same time I thought that I will be speaking to most of the young persons, and I think every morning, even today, I think Nirji mentioned about the artificial intelligence. I feel that the future is likely to be handled and dealt more by artificial intelligence. Fortunately or unfortunately, controlled or uncontrolled, it could be a disaster for the world, as like any other development. So I feel that the future is there for artificial intelligence. And the artificial intelligence, the way I look at artificial intelligence as a surgeon, how it will be, because I'm sure you youngsters will be handling these artificial intelligence things, not only in the surgical field, but your mobile phones. I am sure you know that Galaxy 24 or 25 has come. They're claiming that it is with artificial intelligence, and artificial intelligence leads to machine learning and software updation. And that is the reason why today we are talking about the very brief, non-technical introduction to the field. Now we know that the technology is evolving all over the world, and everything evolves. The present becomes past, and the present becomes future. And this is what we are standing in the present, and I think we should look at the future which is going to become past as you all grow. And whatever I think we are talking today may not be true tomorrow. And that is what is the importance of evolving technology which we are talking about. So when the technology is evolving, we should look back with pride for India that we had a situation that we believed in, all of us, that there was a situation where Dhritarashtra was given a live thing what is happening in Kurukshetra. I think, he was being blind, but was given expressed. So I think we belong to that country, we belong to that culture. And as Mr. Sonam has also talked, the Vedic time, when we had technologies which were available with us, which told us live things, what is happening in the world. Also, we had artificial intelligence with us. We had Pushpak Viman. We talk about the Pushpak Viman, which was not, there was no pilot. It was on instructions. It has a navigational system which took it to Lanka. Like exactly where Ramchandji wanted to go. So I think couple of years back, couple of decades back, I think we all as a young children, we thought it's just a matter of imagination. But I think as the time passes, we realize that today we have got the artificial intelligence, we have got the navigational facilities with the unpiloted, the sort of flying vehicles which are controlled by voice or by various methods, and it will not need any physical sort of thing. A lot of us at our younger generation, we saw this famous Star Trek television show with a lot of awe and a lot of things which we thought that possibly something which excited us, that can there be something else? But now today we are talking about the space station where people are going, people are taking the nutritions, they are taking the water, and then the space people are coming back. So I think it's a matter of evolution in the future. And this is such evolution which took place in the world about 35 years back. And I think I feel very proud today that Indian like me came across this in '89, sitting in America, and then 4 patients were operated by laparoscopic method. And what is laparoscopy? Put punctures in the abdomen, 2, 3, 4 punctures, put in a telescope inside. The light goes from there. The camera is there to show you image on the television. And you look at the television and operate. This is exactly what I told you before, that what is important. And this, to make this slide 35 years back, took almost a full day. And it is, I thought that I was that person who's imagining the flowers across the valley, standing on the ground of open operations, going into the laparoscopic or endoscopic operations, not knowing the future of this thing. But there was some conviction that this is a human-friendly operation. And that is how I took that jump, and along with quite a few persons in the world, we took that jump of moving from conventional operation theater to the laparoscopic operation theater. And this is a picture. On one side you see the open operation, the scar, which was very big scar, which must have been very, very painful, must have taken weeks and months to heal, versus the scar of laparoscopy, which are just a couple of punctures there. But it is not only the punctures, but I think the philosophy of operating changed with laparoscopy. We bothered more about not the scars, but we bothered more about how much pain we should be able to give the patient and how can we prevent the misery of operation and misery of getting cured by your surgical intervention, which is always a fraudful sort of thing. Another disadvantage to us as a surgeon was that we moved from three-dimensional surgery to a two-dimensional surgery. And this is the crux of my presentation today, that 35 years back, we went to a handicapped way of operating by cutting one dimension. And I think we have the most eminent creative, Mr. Raghu, who's going to be talking. And that is how he transforms the three-dimensional things into two-dimensionals and makes us feel that they are three-dimensional. That is what the art is. And I think within no time, the gallbladder surgery became very common to be done by laparoscopic surgery. And as the technology advances, I think, from gallbladder, we moved to hernia, to the heart surgery, to practically every type of surgery is being done laparoscopically. And I feel that 25 years back, the country, the opinion makers of the country changed their thinking and believed in Indian doctors and Indian surgeons. I had the honor of operating President K.R. Narayanan 25 years back, and this is the first time the opinion makers decided to get operated by an Indian doctor in the Indian hospital by the world's top technology. So this was a confidence. It is not operating the president. So this, I think, is a landmark. Otherwise, we have heard our presidents going abroad and getting operated and coming back. It was the trend changer for the medical science. And since then, I'm sure not many people have gone abroad for the treatment. Forget about some socialites, but no eminent person has gone abroad for any type of medical treatment because we have kept pace with the technology. And this is 24 hours after. He was 83 years when he was operated. And you can also see younger of me when we waved to the crowd 24 hours after his gallbladder operation. Also, then we created the world record of, the guidelines for the country. He requested us to make the guidelines for the country, how this laparoscopic surgery to be done. Now I'm very proud that I'm serving the 6th President of India as a surgeon to the President of India. And with the President of India, everything changes, as you know, including their butlers, everything changes. And I think I've been very fortunate to be serving the 6th President of India. Kalam Sahab was very keen. He wanted to work on a simulator. So I think Kalam Sahab came to our hospital and wanted me to teach him laparoscopic way of handling the instrument. And this is exactly, on a simulator, he wanted to see. And this is his curiosity. I think it's very, very difficult to express or explain the curiosity and the learning feelings which he all had. We, of course, had the fortunate of, again, honor of operating Mrs. Pradeep's husband, Pranab Mukherjee's son, and of course, this is, I think, the ultimate which one can surgeon think of, operating Dalai Lama in 2008. And you can see him walking out 24 hours after his surgery, and I'm still blessed by him. And today, we have got so much of love and affection from him. And we continue. I think 2 weeks back he was in Delhi and I had a telephonic conversation. We will have a very casual cup of tea. Whenever he's in Delhi, he will make requests and come and meet the family. So, but then laparoscopy is not enough. Operating the dignities is not enough. Apart from operating, of course, the general public and general population. Time to move. What is important for all of you is that you are moving out today. And this is the time to move ahead. Don't get stagnated by whatever you learned here. This is just a day where you are getting a degree, you are getting the next phase of this thing, but always think about moving ahead. And exactly this is what we thought, that laparoscopy, moving away from laparoscopy towards another technologically advanced method. And you see my first slide. And now today I am on the second slide. What you see is the bungee jumping. So previously that was a step. Now we are relying on the technology and jumping from a height, knowing that the technology is reliable and will not get killed, will not get you killed. And that is what is the robotic and artificial intelligence is going to come. Today what you are knowing and what you listen, I think tomorrow you will be thinking more of the artificial intelligence. And just in 2 words, I would like to explain to you about the artificial intelligence. Is there a problem solving and decision making? Problem solving and decision making is what is called artificial intelligence. But you must not get scared, may not get feared, that the problem solving decision is important from coming from the human mind. And how you are going to transmit is over the machines. And when we talk about the artificial intelligence, I think it is going to be the artificial general intelligence, because it will never be beyond human thinking and mind. And that is what I think we have to change. And you must know that the software which you are using is going to change. The conventional softwares had a predefined output, what is going to come. So you have put in a software and whatever is going to come is predefined. But in artificial intelligence, the softwares are individualized for a particular branch, for a particular purpose, for a particular aim and what you want to create. So it's a think and decide software. Now how this artificial intelligence will come to you? It has to come through a machine. It has to come through your telephone. It has to come through the mic. It has to come through the cameras. It has to come through various teaching and training modalities. And that is what is a machine learning. How you train your machine and how you create a special software. And that is what today we talk about, the robotic system. The first FDA approved robotic system came in 2000. I will quickly finish, just introduce you to robotic. Fortunately, one Indian surgeon out of 12 surgeons was given this opportunity to give this FDA approval. I happen to be one of those 12 persons in the world to give approval to this robotic technology, which was US based. The biggest thing which happened to me as a surgeon and to medical fraternity was that we moved from 3-dimensional to 2-dimensional laparoscopy. Now we are back to 3-dimensional. So all the robotic surgeries are 3-dimensional surgery. And today, where do we stand? Let's see. Now this is a robotic system. You see the patients, this is a simulator, and you see the robotic arms, 4, 5 robotic arms which go inside the abdomen. The surgeon is controlling, and Mr. Raghu, I think you will be happy to see the scroll sent to me by when I told His Holiness Dalai Lama that we are moving to robotic surgery. He sent a small, this thing you can see on the console surrounded, that scroll of blessing. So we are very fortunate to have his blessings. And these are the arms which has got a shoulder joint, which has got an elbow joint, it has got a wrist joint, and this is what the technology is. And this is how the surgeon sits on the console and looks at the monitor, has got all controls in the handles. You can turn left, right, up, down, zoom in, zoom out. Everything is done by the hand control. Just a glimpse of an operation theater. And this is the gallbladder operation, which is done by that. You can see the arms moving. And these are the instruments moving inside the abdomen. So this is exactly, I think you have to just concentrate. And this is a surgical hand. And you are controlling all those movements in all the dimensions, 360 degree. The surgical controls are there. And this is how the gallbladder operation is done. And this is gallbladder. And we can move on. Now this is, when we brought this technology to India, we realized that not many people were willing to go in for this. But I think this graph has shown that how quickly the technology was adopted. And in 2022, we are fortunate to receive 2 world records of the most experienced robotic surgeon in the world. Being an Indian, we feel very proud that it has come to India, not to other worlds. And we just talked, Sonamji has mentioned that, we have to feel proud of what we possess and what we have inherited and how we are being part of the future in the world and telling. It's not, I think, Mahatma Gandhi said that you stand in your own country and let the air and the waves and the knowledge come from any part of the world. You imbibe that knowledge and bring technology and the knowledge to us and to all of our colleagues, and let this go be transmitted to other places. So 403 times more surgeons are doing. I think we talked about the robotic surgeon. There are 400 times increase in last 6 to 8 years. So you can see the technology. 840% more operations are done robotically now. But ultimately, to conclude, I would definitely like today, all you youngsters are moving out. Teamwork. Teamwork is the most important thing in life. Individually, as I think, Mr. Daulat has said, Kabir ke doha jo bola tha, कि बहुत tall होने से कोई फायदा नहीं है. It is not important. The tall होने से ना किसी को important है, except and of that after some time it all disappears. So I think you should not be a magician. Any artist, he should be able to teach the youngsters his art so that they can take it from there and take it to different level. And our aim is that they should start to a level from where we are going to end or we are ending. So it is also very important then when you are training somebody, actually you are learning. You feel that you are training, but actually in reality, you are learning. And if you are learning, you are going to become bigger. And the teamwork is important. So all of you going, please try to make your team, group of people, have your youngsters, have your seniors, adopt and adjust to the seniors and train the juniors. Don't be magician. Don't hide it under the cover. So express yourself, let the people's intelligence give input to you so that you can do much better. So teamwork, to give an example, my team is 37 years old now. My number 2 surgeon has been with me for 37 years, and that team continues till today because we all know how to move forward. So I think, we all should look that robotic surgery is going to be our friends. And as a surgeon, I have always felt that we have the great privilege of operating another human being, and that gives a very big responsibility to all of us in society. And this is my team from Max Institute, and as I said, teamwork is very important. And finally, the message always remains that the journey continues. It is just a journey, it has to continue. And thank you very much. And I wish you all the best in your future, and I'm sure you will be getting a lot of inspirational messages today. Please keep it close to your heart. Try to see as much as you can incorporate, because there's so much of wisdom on the dais and off the dais for sitting, and it's a great honor for me to be amongst all of you. Thank you very much and all the best. Thank you.